let's pay particular attention now to what we need to do to pass our test. Okay, we're doing this for all of you guys who wanted to pass your test. Okay, welcome to session 6 of my quick fix review for the NCLEX. Okay. Okay, this time the lucky charm giveaway, which is the blue cup. Okay. Okay, it matches my shirt. Look. Okay. So I'm giving this away. Okay. Are you ready to log on your answers to the chat box? Okay, go. Now you will have to tell me who is the person I'm with. Okay? Who is the person occupying position number 1 on the picture? Some say Jed Madela. Some say Boy Abunda. Ano ba yan? Okay. Who I'm with. Okay. Okay, game na tayo. Sino ang kasama ko? Oy, Piolo Pascual, Richard Yap. Ano ba yan? Kung ano-ano. Chavit Singson. Oy, hindi naman. Sobra naman kayo. Oy, President Duterte daw. Bekenemen. Bongo. Okay, here we go. The first one who gave the correct answer will win the cup. Okay. Secretary Duque. Bico Soto, Coco Martin. Okay, game na. Okay. Manny Pacquiao daw. The winner is... Tara! I'm with Kuya Boy, of course, our dear family friend. Okay. Yung una, siya ang nanalo. Okay? Ayan. Okay. Don't judge a picture based on the belly. Okay. So go na tayo. That's Kuya Boy. This was taken in Rostan's, Makati. Okay, sa coffee shop. Okay, go. So remember, I'd like once again to request you to join us in this mission. My goal is to provide free NCLEX RN application review to 100 nurses. For the review, my foundation is shouldering that. For the application, that's where we're seeking out sponsorships. And to achieve this, please just watch our videos on our YouTube channel, Gapos Mentors, and finish the ads. By finishing the ads, allowing the ads to finish before checking in our videos would enable us to earn funds for our scholarship programs, okay? Okay, let's move on. If you have questions after the class, send me your questions through this email, mentor.raygapos@gmail.com. Okay, opening our third session for the day, session 6. Here's a thank you note from JJ Tapia. Sir Ray, thank you so much. I'm now USRN. Thank you for giving me all the information, functional concepts, and for your motivation. The best NCLEX review and the best mentor. Thank you, JJ, USRN from the Ilocos region. Okay. Now, this is when I did a talk with our Nepali friends, nurses. Okay. Okay, that's me with the Nepali inspired outfit. Okay, so because I'm sharing with you some culture-specific considerations, so that's actually a way to open up transcultural nursing concepts. Now, a lot of people are saying, do we really have to, how much time do we have to allot for studying transcultural nursing concepts? Now, what is difficult for the NCLEX is that sometimes this is a very broad topic, okay? Especially if it deals with Chinese cultural concepts like the yin and the yang, okay, or the use of alternative medicine, okay, like your herbal remedies, okay, and sometimes they entail studying intervention about interventions like yoga, acupressure, acupuncture, okay. So this is very, very important, okay. So let's have a sample question immediately. Which of the following statements best describes a nurse's understanding of what were discussed in a nursing conference on transcultural nursing? Now, The main topic here is transcultural nursing. It's never about the nursing conference. So let's analyze. Shaking the head from side to side does not always mean no. Yes. Our Indian friends could attest to that. When they shake their head from side to side, it means yes. So we put a check. Okay. A bluish discoloration on the lower back of the child of African descent is indicative of child abuse. Now, when you have dark-skinned children below 5 years old, they have what we call Mongolian spots. Okay. For as long as it doesn't approximate the markings of the fingers and the hands, so it's not suggestive of child abuse. So this is common among children of African descent, Asian, African American descent, Native American Indian, and Hispanic children will have Mongolian spots. After age 5, this gradually disappears. Okay, so yes, we put a check. Okay, a bluish discoloration of is indicative. This is supposed to be not indicative. Sorry, this is supposed to be an X. Sorry for that. Middle Eastern clients respond better to male healthcare provider. Yes, because they belong to a male-dominated society. Okay. Okay. A client who is a Seventh-day Adventist has higher risk of pernicious anemia. Yes, because they usually pernicious anemia is due to vitamin B12 deficiency, and vitamin B12 is usually sourced out from your meat and meat products. Okay, usually Seventh-day Adventists don't have that; they have veggie meat. Okay, so in kosher diet, eating meat immediately after eating dairy products is allowed. Now, this is something that I know most of you would raise your eyebrows if I say yes. Why? Remember, in kosher diet, okay, the sequence of eating meat and drinking milk is the one that's crucial. First, if you eat the meat first, yes, this is supposed to be an X. This is supposed to be an X, okay? If you eat the meat first, listen up, if you eat the meat first, okay, the particles are, some of the particles may stay in between the teeth, such that when it gets mixed up with the dairy products, then that's no longer considered as kosher. Therefore, okay, if you eat the meat first, you have to wait 6 to 12 hours before taking in the dairy products. But sometimes the interval depends on where the patient's coming from. Like, for example, Jewish client of German descent would just advocate for waiting 3 hours. For those who have Danish descent would just advocate for waiting 1 hour. So the key is, when you eat meat initially, you have to have a waiting time before eating the dairy products. But if you're doing the reverse, when you eat the dairy products, since it doesn't necessarily leave sediments into your mouth, then it's all right to eat the meat after. Okay, so let's analyze this thing. In kosher diet, eating meat immediately after eating dairy products. So the patient first ate the dairy products before the meats. So what did we say? Yes, this is acceptable. But if the patient ate the meat first before the dairy products, there has to be an interval of 6 to 12 hours. Okay? Okay. Next, okay, what is important that you have to remember here? A Jewish client who died can be cremated. Okay, now this is usually not done, okay? For Jewish patients, they are buried in simple rites, and this is the time that they're usually wrapped in a shroud and placed in a simple wood coffin. Now, in their wake, actually flowers are not permitted, and the relatives would usually be at the, let me just allow some of your friends who are just coming in, might be distracted. The relatives are usually allowed to stay with the body of the patient until burial is completed. Now, what is important that you have to remember when we are talking about Jewish burial practices, okay, is the fact that here, cremation is not allowed, okay? So this is actually an X, okay? Thank God, you have an X there. And then Black African Americans have the greatest colorectal cancer incidence and mortality. This is supposed to be a check. Yes. Yeah. Okay, good. Okay. Now let's pay particular attention now to amlodipine. Okay. Now amlodipine, take note, is a calcium channel blocker and it lowers the blood pressure. So the priority assessment for a patient who's taking amlodipine would be the blood pressure. Now the common side effects for amlodipine would be swelling, usually swelling of the ankles, okay, of the lower extremities, okay, and then excess fluid in the lungs, and then nausea, and then dizziness. But the most common would be swelling, okay, on the ankles of the lower extremities, okay. Okay, so next, let's talk about constipation. Now, constipation refers to having fewer than 3 bowel movements a week. In essence, listen up, it becomes a problem for patients with the following conditions. Select all that apply. Multiple sclerosis, yes, because they have impaired bowel function. Colon cancer, yes. They usually have alternating diarrhea and constipation. Parkinson's disease, yes. Stroke, yes. Spinal cord injury, yes. Now, in patients with ulcerative colitis, they have bloody mucoid diarrhea. So we don't have a constipation for number 6. So we put an X. Okay. Next, let's move on to rotavirus infection. This is fun, a little faster. Okay. Rotavirus causes diarrhea-related dehydration in babies and young children. This is the reason why you have a vaccine for rotavirus infection, because it could potentially lead to death associated with dehydration, okay? So which of the following manifestations are indicative of a complication of rotavirus infection? Now remember, if you talk about complication, remember about dehydration. Absence of tears in a 2-week-old baby. Here's what makes the difference, 2-week-old. There's really no tears when the baby is younger than 6 weeks. Tears form approximately at 6 to 8 weeks. So this is not a sign of dehydration, we put an X. Decreased urination in a toddler. This is a sign of dehydration, so we put a check. Dry mouth in a 4-year-old. Yes, that's a sign of dehydration. We put a check. Constipation in a 5-year-old. Again, we don't have, your rotavirus infection causes diarrhea and not constipation. Put an X. Unusual sleepiness in a 2-year-old. This is a key phrase. Unusual sleepiness may be due to dehydration affecting the central nervous system, so we put a check. Okay, now, let's talk about Paget's disease of bones, okay? Now, there's actually another form of Paget's disease. It's called Paget's disease of the breast, okay? So Paget's disease of the breast is a rare type of cancer that usually affects the skin of the nipples, okay? And you would know that there's Paget's disease of the breast or of the nipples when you have a flattened nipple, okay? And when pressed, there's going to be usually a yellow or bloody discharge. So if you asked your partner if he or she has Paget's disease of the nipple, so that means there's a flattened nipple. Okay. Now, what about Paget's disease of the bone? Okay. Paget's disease of the bone is characterized by a weakening of the bone that leads to deformity. And there's no specific treatment for Paget's disease of the bone. The medications that are usually given are the same medications that are given in patients with osteoporosis, okay? So the thing that you have to deal with when a patient has Paget's disease of the bones is that sometimes there's gonna be pain and numbness, okay? Don't give me that Gollum look when you see Paget's disease, okay? So here's a functional concept. Risk for Paget's disease of bone increases with age and its presence in a family member, okay? Biphosphonates, okay, are the mainstay of treatment for Paget's disease of the bone, okay? And this would include, example would be your alendronate or Fosamax. Now, if your patient's taking your alendronate or Fosamax, instruct the client to be upright or engage in activities after taking it. Take it with water, not mineral water, because that decreases the absorption of the drug. So stay, okay, upright, because there's a possibility of esophageal irritation. So the activity that's appropriate for a patient who's taking biphosphonate immediately after taking the drug is to read either books or read the newspaper so that they remain upright for at least 30 minutes after taking the medication, so as to avoid or to prevent esophageal irritation. Okay? So let's move on. Alendronate or Fosamax is used to treat Paget's disease, also used to treat osteoporosis. Okay, so let's talk about osteoporosis now. Let me just, okay, welcome back, your friend. Okay, there's another one. Okay. So osteoporosis is characterized by brittle and weak bone. Brittle and weak bone. So what causes osteoporosis is it actually depends on the type, which we will identify later on. However, older postmenopausal Asian women are most at risk to osteoporosis because it's believed that the diet of Asian women are usually very low in calcium. Okay, so the difference between type 1 and type 2. So type 1, postmenopausal women, okay, would usually develop osteoporosis type 1 because of the decrease in the hormone estrogen, okay, which could actually lead to weakening of the bone. Type 2 osteoporosis is also sometimes known as senile osteoporosis, and primarily it's associated with long-term calcium deficiency, okay? Now, what exercises are appropriate for bone health? Okay, it's walking, jogging, running, stair climbing, skipping rope, and skiing, okay? All of these could actually challenge the density of the bone. However, there are also exercises that does not promote bone health. And what are these? You have your swimming, cycling, and use of elliptical training machines. So if you are suffering from osteoporosis and you're swimming, that's not gonna help your bone. Cycling, that's not gonna help your bone, but walking and jogging would definitely help it. Okay, so the most common form of secondary osteoporosis is associated with long-term intake of glucocorticoids. So if the patient has been having treatment for steroids for the longest time, expect that the patient may develop osteoporosis. Okay, here we go. Let's use what we have just discussed. Which of the following exercises are indicated to promote bone health for patients with osteoporosis? Select all that apply. Swimming, okay, no. Skiing, yes. Stair climbing, yes. Cycling, no. Skipping rope, yes. Excellent. So remember that calcium supplements of 1,000 milligrams per day. Now for pregnant patients, you have to add 200 milligrams. So that's a total of 1,200 milligrams per day for pregnant women. With vitamin D are necessary to prevent osteoporosis. Remember, vitamin D plus calcium. Now, what are the sources of your calcium? You have your dark green leafy vegetables. You have your broccoli, colored green. Canned salmon or sardines, calcium fortified cereals and orange juice, and of course your tofu. Tofu could contain like 800 milligrams per serving of calcium. Okay, so let us be reminded by what John Maxwell once said: if you aren't making any mistakes, it's sure sign you're playing it too safe. Sometimes we need to take a risk in life because for all we know, that risk that we are taking would eventually spell out the difference. So thank you for joining me today, for taking the risk, okay, out of, postponing some of your appointments and joining me today. Way to go. Let's proceed. Okay, the next thing I'd like to highlight would be Russell's traction. Okay, so what are the things that you have to remember about Russell's traction? Now, care of the patients with traction in general. Okay, so always remember that the trapeze bar is used to lift the body to move the patient, and the weight should be freely hanging. Nuts should not be there. So there has to be freely hanging weights. Then you have to assess the client's skin, specifically the attachment side. The distal part, you have to assess it for circulation. And then temperature elevation in a client with skeletal traction needs to be reported to the provider. Now increase the client's fluid intake, okay? Why? If the patient is in a traction for the longest period of time, there's a chance that calcium leaves the bones and then eventually it forms renal stones, okay? So observe the client for complications. Never remove traction weights unless indicated, and the skin must be frequently assessed. Remember the code, tractions, and that's contained actually in our NRS book resource, okay? Now, severe muscle spasm in a client in traction indicates improper alignment and must be reported to the healthcare provider. Now, what medication is usually given to patients in traction with severe muscle spasm? Diazepam to relax the muscles is usually given, okay? So here's an example of a drawing of your Russell's traction, okay? You have to take note of the different parts and how the traction is attached, okay, to the weight. And remember, there should be no nuts. So that should be freely hanging weights to provide, the body provides a counter traction. Okay, so Russell's traction is a skin traction in pediatric clients and it's skeletal traction in adults. Let's try answering a sample question. A client with herniated intervertebral disc is placed on a traction. Which of the following observations requires a need for further instruction from the healthcare provider? We're looking for something that needs for further instruction, which simply means we're looking for something that's incorrect or wrong or would put the patient in danger. What did we say a while back? There should be freely hanging weights. Therefore, the nut in the pulley needs further evaluation or instruction from the healthcare provider. Okay, all the rest, weights are hanging freely, client is in supine position, legs are attached to the weights, are correct based on the principles of traction. Okay, now let's talk about electrolyte imbalance. And today we're going to talk about 2 electrolyte imbalances, and this is the first one rather. So here's a functional concept. The kidneys control the body's potassium levels. Therefore, how do you operationalize this functional concept? To operationalize this functional concept, you have to remember that if your patient is having increased urination, that signifies that the kidneys are excreting fluids and potassium. The patient is in danger of hypokalemia. Therefore, what are the conditions that potentially increases urination? Like when the patient is taking diuretics, not unless it's potassium sparing. When the patient has diabetes insipidus, when the patient has diabetes mellitus, they have polyuria. So if a client comes in with decreased potassium levels, it's very important to assess the presence of diabetes mellitus or diabetes insipidus, or if the patient's taking diuretics, that could potentially explain why the patient's having low potassium levels. Okay, here we go. What are the signs and symptoms of potassium imbalance? When it's low, remember, you have your FACAWA, okay? Fatigue, alkalosis and apathy, constipation, abnormal heart rhythm, weakness, abdominal cramps. Take note of the abdominal cramps. That's indicative of low potassium. When it's high, remember pain D, palpitations, acidosis, irregular heartbeat, nausea, and diarrhea. So when it's high, you have acidosis. When it's low, you have alkalosis. Take note, muscle weakness, nausea, and vomiting occurs in both. So muscle weakness is not exclusive for hypokalemia. It could potentially occur in hyperkalemia. So when you have muscle weakness with acidosis, that's hyperkalemia. Muscle weakness with alkalosis, that's hypokalemia. Muscle weakness with constipation, that's hypokalemia. Muscle weakness with diarrhea, that's hyperkalemia. Okay? So hypokalemia leads to alkalosis and hyperkalemia leads to acidosis. Muscle weakness, nausea, and vomiting are present in both hypokalemia and hyperkalemia. So a client complaining of weakness, nausea, vomiting, constipation, and abdominal cramps is admitted. Which of the following questions is appropriate for the nurse as a client to assess the client's condition, to ask the client to assess the client's condition? So you have your patient with weakness, nausea, vomiting, then you have constipation. So we know for a fact that when you have weakness plus constipation, that's hypokalemia. Then you have the characteristic abdominal cramps. So what comes to mind? Again, syndromic approach, hypokalemia. So what do we ask the patient then? We're going to ask, have you been diagnosed with ulcerative colitis? Any direction? No, constipation doesn't occur in ulcerative colitis. Although abdominal cramps would, okay? Do you have diabetes mellitus? Bingo. Patient with diabetes will have polyuria. Then the patient will be excreting so much of the potassium that led to the weakness, nausea, vomiting, constipation, and abdominal cramps, which are all indicative of low potassium levels or hypokalemia. Okay, so if you're having difficulty right now, Albert Einstein once said, when you're going through hell, keep going. Because on the NCLEX, when the questions are becoming more difficult, thank God you're having difficult questions. Remember, you're going up the ladder of Bloom's taxonomy, okay? So let's move on. Now this time, okay, let's talk about hypomagnesemia, okay? Okay, electrolyte imbalance may cause behavioral abnormalities, and usually behavioral abnormalities could be associated with low levels of magnesium. The normal level of magnesium in the blood would be 1.7 to 2.2 milligrams per deciliter, or 0.85 to 1.10 millimoles per liter. okay? And the functions of magnesium includes maintaining blood pressure, like your sodium and potassium, nerve impulse transmission, okay, cardiac function, like potassium, glucose and insulin metabolism, and of course, protein synthesis. Okay, so manifestations of low magnesium includes, remember, stamp, seizures, tingling and numbness, abnormal heart rhythms, muscle cramps, and personality changes. So if you note personality changes with seizures, think about low magnesium levels, okay? So hypomagnesemia is caused by, remember the code PACE-MAG, okay? Pancreatitis, okay, which could lead to balanced nutrition, alcohol use, chronic diarrhea, excessive urination, like in the case of clients with diabetes mellitus, and those who are using diuretics, or when there's excessive sweating, malnutrition and malabsorption, like in the case of a patient with celiac disease. Now, take note. In a patient with celiac disease, remember, there's an update. Oats now can be given to the patient such that the only things we have to instruct the client to avoid when they have celiac disease would be BRW, okay? You have your barley, rye, and wheat, okay? And when you say wheat or wheat products, that includes your Graham crackers, okay? So the diet for a patient with celiac disease would usually be gluten-free. So would they be allowed to take rice? Yes. Corn? Yes. Potato? Yes. Rice noodles? Yes. Okay. Then A, acute kidney failure, and then B, burns. So remember, PACE-MAG. Okay. So treatment of hypomagnesemia involves the administration of oral magnesium supplements, okay? Just oral administration of supplements. Here's a sample question. Let's use what we learned. The absence of which of the following manifestations indicate a positive outcome of the corrective measures implemented to treat hypoglycemia? This is kind of difficult because it's asking, it's providing you a lot of details. First, it started with a negative word, the absence. So, and then you have here a positive outcome. So you have to look for the absence of a symptom, okay? That indicates correction of hypomagnesemia. So what would tell you that the patient is no longer having hypomagnesemia? That's the essence of the question. So what did we say a while back? Okay, in patients with hypomagnesemia, they're usually prone to develop seizures. So the absence of seizures now indicates that hypomagnesemia has been corrected. Excellent. Now, what is difficult with this type of question? It's actually about understanding the question or comprehension. Okay, that's what NCLEX is all about. You cannot prepare for the NCLEX by mimicking other people. Prepare for the NCLEX by reflecting on what you read. Okay, so writing down notes is already old school. Okay, that's very traditional. The reason why a lot of students don't make it on the NCLEX is that they have a wrong notion that they have to write down every single word that the traditional teacher would usually do in terms of giving lectures. You see, when you give lectures, you are memorizing facts. You're not reflecting on the facts. You are not threading through the facts. You are not creating a story with the facts. What you're doing is actually just blurting out information, and if it's not processed, then there's no way for the listener to know how to use those facts to answer questions. That's what matters, and this is where functional concepts come in, which is actually a registered trademark of my system. That's why I'm sharing it for everyone for free, okay? So let's move on. Now, okay, let's talk about your herpes zoster, okay, and how it's different from herpes simplex, okay. Now, when you say herpes zoster, it's actually due to the reactivation of the chickenpox virus. So what will you see in the history of patients with herpes zoster is that they have been infected with the varicella virus in the past. So how come it's being reactivated? For all we know, some people would believe that once they had chickenpox, they will no longer have it. Yes, they would no longer have chickenpox, but they could potentially have herpes zoster. And it's because of a weakened immune system. So if you have had chickenpox infection in the past and then your immune system weakened, then this could be contributory to the development of herpes zoster, okay? So the prototype drug for herpes zoster would be your antiviral agents acyclovir, and it's best given within the first 3 days or 72 hours of onset of the lesions related to herpes zoster. Okay. Now, sometimes the lesions could come with pain. So altered comfort of the patient is a primary consideration. Okay. So the presence of blistering sores in the mouth and genitals may indicate infection with herpes simplex virus. So what's the difference between the herpes simplex virus and the herpes zoster virus? Okay. Now, the herpes simplex virus comes in two forms. Herpes simplex virus 1, which is oral, and herpes simplex virus 2, which is genital. But take note, your herpes simplex virus 1 could also be spread to the genitals, and your herpes simplex virus 2 could also spread, okay, to the mouth. Okay, so you know what I'm thinking. So herpes simplex virus 1 could be transmitted through sores, saliva, or surfaces around the mouth to the genitals, and herpes simplex virus 2, okay, could actually be transmitted through sexual contact. Okay, what are the common risk factors for herpes simplex virus 1? Sharing of utensils or sharing of lip balms and other cosmetics that's applied on the lips, as well as kissing. For herpes simplex virus 2, you have multiple sexual partners, weak immune system, sex at a young age, and having sexually transmitted infection. Okay, so let's move on now. What you see here would be the lesions of your herpes simplex virus 1. Okay. So this is herpes simplex virus 2, okay? Look at the sores and the blisters that occurs in the genital, okay? Here, genital, okay? For the male and for the female. Now, treatment for herpes simplex virus may include the use of, take note of these 3 commonly used drugs, acyclovir, famciclovir, and valacyclovir, okay? Topical steroids, when used alone as a treatment for herpes simplex lesion, may delay healing. So when you use steroids, it has to be in combination with strong antiviral agents like any of these 3, acyclovir, famciclovir, valacyclovir. Okay? So let's apply what we learned. The client is being treated for skin lesions. Click on the exhibit. Which doctor's order should the nurse question? Topical steroids. Use that alone, it could delay healing, okay? Now, to differentiate the lesions, okay, of your herpes zoster virus from your herpes simplex virus. Now, let's take a look at what happens when you have shingles, okay? Now, you would notice that in patients with rashes associated with shingles, it forms what we call the stripe pattern, okay? Of lesions. Okay, we're trying to compare now manifestations. This is your shingles rash. Okay, now is this painful? Yes, and it could actually occur anywhere in the body. So usually the shoulders, the head, the shoulders, the back, and this is very painful. Okay. Okay, now let's talk about C. diff or Clostridium difficile, which actually causes gastroenteritis. Okay. Is a bacterium that causes diarrhea and more serious intestinal conditions such as colitis. It affects usually the elderly, those who are on prolonged antibiotics. Now, seldom that it occurs in patients who are not on prolonged antibiotics, okay? So usually it does not occur in persons who are not taking antibiotics. That's what I'm trying to say. If you are taking antibiotics, the more prone you are to Clostridium difficile. Okay, so C. diff infection is usually common among those who have prolonged hospital stay, the elderly, and prolonged use of antibiotics, PEP. So let's try answering a sample question. Which of the following clients is most at risk to develop C. diff? Okay, 35-year-old post-appendectomy due for discharge, 65-year-old on neomycin due to infected insertion site of skeletal traction, 20-year-old on community-based alcohol rehabilitation program, and you have a 40-year-old post-cataract surgery patient. So our answer here is actually the patient on antibiotics, 65-year-old on neomycin due to infected insertion site of skeletal traction. Okay, now, there's one specific concept about alcoholism that I'd like to highlight. And what is this? Codependency. Codependency is characterized by one person's enabling another person's addiction, immaturity, irresponsibility, or poor mental health. In Tagalog and Filipino, we call this pangungunsinte. Now, this happens when, for example, the wife of an alcoholic husband covers up. For example, if the husband drank too much the night before and was unable to go to the office the next day, and the boss calls, and then the wife says, oh, he is sick, even if he knows that the patient is having withdrawal symptoms. Okay, that's why the patient was unable to report for work. That's codependency. You are enabling another person's addiction. Okay. Now, here's a question. Now, what if on the NCLEX, that's not what is asked directly? Look at this question. Which of the following statements of the wife of an alcoholic client indicates resolution of codependency? This is the reverse. So you know for a fact that when you support the behavior, okay, you become a codependent. So how would you know that you're no longer a codependent? Is it 1, I just felt the need to agree to his request to save our relationship? 2, I need to do this to have a harmonious relationship. 3, I stopped defending my husband from his boss and I threw all alcohol in the house into the garbage. Or 4, I need to agree to cover him up as my way of showing support. Number 4 is indicative of codependency. Number 2 is indicative of codependency. Number 1 is also indicative of codependency. Number 3, look, this indicates that the patient has awakened from being a codependent and would no longer support the husband's addiction. So the patient says, I stopped defending my husband from his boss and I threw all the alcohol in the house into the garbage. Okay, that's the correct answer. Okay, now let's move on to congestive heart failure. When I say CHF, okay, let's talk about the heart this time. Okay, so it's the inability of the heart to pump adequate amount of blood to meet the metabolic demands of the body. So usually, congestive heart failure is a complication of other conditions that is either directly affecting the heart or indirectly affecting the heart. Could be related to conditions affecting the kidneys, okay, conditions affecting the lungs, okay. So here's an example of a question. Which of the following is an early sign of heart failure? When my student was actually asking me, sir, is there something wrong with the question? What is wrong with the question? It's not identifying whether it's left-sided or right-sided. What you have there is actually just the word early. Now, this is actually the trick. Always remember the functional concept. Left-sided heart failure develops first before right-sided heart failure. Therefore, okay, when you say early sign of heart failure, you refer to left-sided heart failure. And with that, we answer dyspnea. Okay, let me explain why. Left-sided heart failure develops first and may cause the early signs of heart failure. Left-sided heart failures would usually have symptoms associated with the lungs like dyspnea, difficulty of breathing, okay, moist cough. Okay, right-sided heart failure would usually have manifestations that affect systemic circulation, like neck vein distension, weight gain. Okay, in both instances, there's fluid volume excess. So if you don't see heart failure on the test, okay, and you see this label, fluid volume excess, think of heart failure. Okay, so let's try answering a sample question. The nurse should assess the client with a diagnosis of right-sided heart failure for which of the following. So we're talking of right-sided heart failure, diminished breath sounds, that's to the lungs, distended jugular veins, yes, altered mental state, substernal chest pain. So the answer is definitely distended jugular vein. Okay. So here's a select all that apply question. Which of the following manifestations indicate right-sided heart failure? Dyspnea, that's for the left-sided, put an X. Moist cough, put an X. Edema, put a check. Jugular vein distension, we put a check. Ascites, we put a check. Hepatosplenomegaly, we put a check. All of these would usually affect systemic circulation. So right-sided heart failure. Okay. Now let me actually go back and differentiate systolic from diastolic heart failure. Now, both systolic and diastolic heart failure affects your left ventricles. The problem with systolic heart failure is the left ventricle is unable to contract. So the problem would be about pumping blood. In diastolic heart failure, the left ventricle is unable to relax. So therefore, it cannot be filled with adequate amount of blood. So the problem would be filling the ventricles with blood. So if you have a pumping problem, then you have a systolic heart failure. If you have a filling problem, okay, the problem is about the left ventricle being filled up with the adequate amount of blood, then you have diastolic heart failure. In both conditions, okay, you end up with fluid volume excess. Okay. Way to go. Let's move on. Now this time, I'd like to highlight this. Some of you might be preparing for the test and you're preparing for how to insert the nasogastric tube, how to insert the urinary catheter. But what about if you are asked the reverse? How do you remove your nasogastric tube? Okay, so let's move on. Removal of a nasogastric tube involves ensure the use of PPE, the dressing pack that involves your gauze and gloves. Okay, you have to introduce yourself to the patient, explain the procedure, gain their consent, then position the client to semi-fowlers or semi-upright, wash the hands, assemble the equipment, remove the tape used for securing the NGT on the nose, then pull the NGT gently until completely removed, then remove your gloves and discard properly, then clean the nose and the face, then document in the care plan and the nurse's notes. Remember the steps, okay? Now, let's talk about syphilis, okay? Don't forget, just one thing, the drug of choice for the treatment of syphilis, and that's penicillin. What about if penicillin is not choice? The best alternative for the treatment of syphilis would be doxycycline, okay? Now, this time, what about if you are asked about the steps of urinary catheterization for males, okay? So when catheterizing a male client, always remember, you begin by, of course, explaining the procedure to the patient and then preparing what you need, okay? Then you wear the gloves and open the catheter set. Remember, this is a sterile procedure. Then using your non-dominant hand, grasp the penis. If the patient is uncircumcised, gently retract the foreskin to expose the urinary meatus. Then you clean it, okay, with cotton tip applicator using your free hand, proceeding from the meatus outward in circular motion. Then get the catheter with your free hand, lubricate with water-soluble lubricant, hold it 3 inches from the meatus, then gently insert. Now, as you insert, ask the client to cough as you advance the catheter, okay? This will help relax, okay, the sphincter. And then advance the catheter up to 6 to 7 inches or until urine begins to flow. Now, to facilitate this, ask the patient to relax and then breathe deeply. And as we always say in Tagalog, hinga po ng malalim. Then gently stretch and straighten the penis until it is elevated to an angle of 60 to 90 degrees to straighten the urethra. And then, once you are sure that the catheter is already inside the bladder, as evidenced by the flow of your urine, now take note that when urine begins to flow, you still need to advance it 1 to 2 inches more, so that you are sure that the catheter is already inside the bladder. Then that's the time you inflate the balloon and then you secure the catheter like this. Inflate the balloon, then you secure the catheter like this, okay? So there are several concerns that we need to focus on. Like when resistance is encountered, when you're inserting it, never force the catheter, gently maneuver the catheter as the patient coughs, okay? What about when you are gathering specimen? You always have to maintain sterile technique. Position the catheter balloon correctly, okay? After inflating the balloon, gently pull back on the catheter until a resistance felt. That simply means that the balloon is now acting as a traction, okay? Positioning the collection bag, ensure it is always below the bladder, okay, to prevent backflow that leads to ascending infection. And when there is no urine flow, palpate the bladder to assess if there is bladder distension. Okay, so once again, shout out time to a lady from Tuguegarao, Cagayan. Okay, Dorina Lorraine Binarao Labao. She passed the NCLEX last September 5, 2020, is now USRN. Congratulations. Okay, Dorina. Okay, and at this point in time, I hate saying goodbye, but you know, this is the time that I know we've done our best for those who are taking the test, okay, this month. Send me a note, share to me your success story. And for those who have yet to take the test and will take it in November, see you again for my QuickFix 3. It's going to be on November 7, 2020. So November 7th, that's a Saturday. So this is the end of session 6. Okay, that's my favorite photo of my graduation in the US. So this is Mentor Ray saying a functional concept a day keeps your NCLEX RN fears away. And the winner of the cup with the letter G, okay, is Anne Lorraine Barnachea. Okay, so we're gonna send you, okay, your cup. Okay, oh, and the other one who answered Boy Abunda, the winner is Jackie Lu Colitoy. So congratulations to our winners. Okay, so those of you who love this video, please don't forget to subscribe and hit the like button and bell buttons on our YouTube channel, Gapos Mentors. Please do subscribe. Share it to your friends so that we can help more nurses pass the NCLEX. Now, at this point in time, ambag ko na po ito sa inyong lahat. This is my way of saying thank you. Being an NCLEX RN reviewer and coach has given me so much in life. I'm giving back through this means, okay? Maraming salamat sa tiwala at sa kahit ano pang pwede kong itulong. Please feel free. See you once again November 7. So if you have questions, ask me through our chat box or send me a note. Okay? And I'd be more than willing to help you out. So thank you so much. Thank you so much, I believe. Thank you. God bless you po, sir. Thank you so much. Lord bless you. Maraming salamat. Sir, do we need to register again? Yes, we'll send you again. Thank you, sir. The chosen timing of the webinar was great. It's a day of a majority. Thank you. More power, sir. Salamat po sobra. Thank you very much. Thank you for the generosity. Yes, as I've been saying, this is not about making money anymore. This is about assisting you to turn your dreams to reality. I've turned mine several years ago and I hope I am able to assist you to turn yours to reality too. So maraming salamat sa tiwala at hindi po ako magsasawa na ibahagi kung ano man yung binigay ng Diyos dito. Okay? So I'd like to say thank you to all of you for trusting me with your test preparations. I'd see you once again, those who are, wow, Gapos Baby 2000. Oh, thank you. I'd see you once again. Wow, very much appreciated po, sir. Maraming salamat. I'd see you once again November 7 for those who are still preparing. Okay. For those of you, somebody asked here, I need a formal review. Oh, there's one that's going to start on October 5. So if you are interested, send us an email. Okay. Long health po, Sir Ray. Thank you. Hopefully, we can help the scholars po. Yeah, just finish watching the ads of watch our videos, finish the ads, please. Okay, so that I have several now. May isang single mom na gusto kong tulungan kasi matalino naman siya. So gusto ko siyang bigyan ng pagkakataon. Gapos Baby 2017. Thanks for sharing your knowledge to us. How to be a scholar po. Send me an email, okay? Tell us why you need the scholarship. Can you help me too, sir? I'm a single mom too, of course. Send us an email. Tell us why you need the scholarships, okay? Yes. We'll send you the link for the November 7th. Gapos Baby 2004. Hi, Jacqueline Diaz. Okay. NLE. Hi, congrats. I thank you very much for happy seeing you here. Gapos Baby 2010. Wow, ang dami nyo. Maraming salamat. Gapos Baby 2003. My God. Okay, Gapos Baby 2004, 2006. Ang dami. 2007. How to enroll down. Send us an email at info@RA-Gapos-Review. Okay. Gapos Baby Cebu, Southwestern University. Hi, thank you for coming. Loyal kami. Of course, we're open sa lahat. This is now for all the nurses. Gapos Baby 1987. Oh, hindi ako naniniwala. 1987, high school pa ako. Hindi ako naniniwala. High school pa ako noon. Okay. I'm so glad seeing all of you here. Okay, next month ulit, kita-kita tayo. And I'm more than, sir, sana po kahit nasa abroad makapag-review. Oo. Okay, Gapos Baby 2000. Wow, ang dami nila. Okay, so I'd like to see you again on November 7. And for those of you who are asking, I'm going to upload this in our YouTube channel. Please do wait. We'll prepare this within 3 days. Naka-upload na po siya one after the other. You can go back. Very contagious, sir. Ang tawa nyo. Nakaloka yung 1987. Thank you again. We'll be taking my exam next week. Yes, send me an email for more additional information, please. I'd appreciate if I can help you some more. Haad naman po sana. Well, actually, this is good also for Haad. Okay. Sir Ray, hope I pass on my Yeah, push pa yan. Thank you, sir. God bless you po. Okay, taking exam on the 10th of November. Attend November 7. Okay, Arnold. Okay. Wish you have review here. I'm supposed to be in the US last summer for a review. However, the pandemic happened. Okay. I'm so sorry. Okay. Anyway, you can reach me here naman. Okay. Okay. So thank you very much. Gapus Grandma. Okay. Okay. Gapus Baby Dagupan 2000 for Hi Ethel. Sana sa Australia. Yes. Okay. Canada. Okay. Yes, sir. We'll wait for November 7th. Thank you so much. From Lyceum Northwestern, Ruby. Thank you for joining me. Okay, once again, my kisses to everyone. And thank you for joining me today. My hat's off. I'm going to have the giveaways delivered. Okay, ayan, yun sa mga nanalo. I'll ask my staff to deliver it. Thank you so much to my friends in India, in Nepal, Indonesia, Vietnam. Okay, Venezuela. Okay. Mexico, thank you. Okay. From Germany, thank you. Okay. Oman, thank you. Arizona, okay, thank you. Qatar, thank you. Vietnam, thank you. Mexico, thank you. Mexico, Pampanga. Joke lang. From Vegas, okay, thanks from Germany. From Singapore, thank you, Veronica. California, thank you. From LA, Chicago, okay, from KSA, California, from Riyadh, thank you very much. Okay, wow. Renelita, okay, 2009. UAE, thank you very much. From Riyadh. Canada Street, Brisbane, Australia, San Francisco, Occidental Mindoro, Massachusetts, Baguio, Pangasinan. I can actually submit an application. Okay. 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 So Jasmine, for your concern, send me an email. We can help you out. Okay. Leia Castro from Dubai. Thank you, sir. Viewing you from Palm Springs, California. Thank you, Ruby. Okay. Gapos Baby 2004 from Rosario, La Union. Thanks much, Sir Ray. God bless you. Salamat po. Okay. Okay. Thank you for joining me once again. See you all. And bye-bye. You have a big heart, sir. Okay. Thank you very much from Riyadh. Bye. Bye. And God bless all of us. Okay. See you once again, November 7th, for those who are not yet taking the test, for more updates. Okay. Spread the word, please. Share the good news to everyone. You can share your handouts. You can share our videos. You can share everything. Okay? This is about your dreams anymore. This is not about me. This is about you. More power. Okay? Thank you. Bye.
Thank you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you.
Bye, sir. Thank you.
Ryan.
Thank you, sir. Maraya ka na gets.
Thanks, sir. Thank you, sir. Bye-bye. Thank you, sir.
See you again sa November 7. Tell your friends.
November 7, yes.
Sir.
Thank you, sir.
Thank
you po.
Salamat.
Bye.
Ingat po.
Salamat.
Thank you.